Thanks for joining me today as we in-service the VersaPAP Positive Airway Pressure Device. PAP devices use pressurized air to help maintain positive airway pressure as the patient inhales and exhales through the device. The VersaPAP device comes in two pieces. The front piece is a manometer and a mouthpiece, and a back piece. You're going to connect the two pieces together like so. Attach one end of the tubing to the stem on the back piece of the device. Then attach the other end to your wall air supply. Since every patient is going to respond differently, start by adding 5 liters of flow. Then, using the manometer, slowly increase the flow until the patient is achieving between 5 and 20 centimeters of water pressure for each breath. The flow shouldn't exceed 15 liters. As they inhale and exhale with their lips sealed around the mouthpiece, watch the manometer. You want your patient to stay in the green zone for optimal therapy. The goal is to find the right flow that will help them take a nice deep breath in, but doesn't tire them out breathing back against it. On inhalation, the added flow increases the amount of air that is being inhaled and also decreases the amount of work it takes to inhale. The positive pressure helps open the airways and keeps them inflated throughout the treatment. On exhalation, it takes more effort to breathe against the flow of air, creating a back pressure, and that will keep the smaller airways from collapsing before the next breath. This positive airway pressure is going to help with preventing or treating atelectasis, reducing hyperinflation, and improving functional residual capacity for a variety of patients, especially helpful for post-surgical patients. What you are going to notice right away is the VersaPAP device may be quieter than what you may be used to. As with all PAP devices, you're going to want to make sure the patient can breathe on their own. If you're going to be using the device in tandem with the AEROBIKA OPEP device, you're going to take the back piece off the VersaPAP device and insert it on the back of the AEROBIKA. Next, you will remove the AEROBIKA device mouthpiece and replace it with the front piece of the VersaPAP device. Using the two devices in tandem gives the benefit of added flow on inhalation, allowing the patient to take a deeper breath in, and oscillatory PEP on extended exhalation because of that extra deep breath in. These two devices were designed to work together to offer a quiet, gentle option for simultaneous lung expansion and airway clearance. You're still going to hook up your VersaPAP device to add flow, again, starting at 5 liters and adjusting the flow to the ability of each patient. You're going to rely on the manometer to ensure that you're in that green target range of 5 to 20 centimeters of water pressure, so your patient is getting the most benefit, but not so much flow that they're going to get tired. It's best to set the inspiratory flow similar to as if you were using the VersaPAP device alone. So it allows for a bigger, easier breath in, but this time factoring in the resistance level of the AEROBIKA device. Again, you will need to work with each patient and their ability to find the right combination of flow and pressure to optimize the therapy, with the goal of staying within that green zone. Your patient will seal their lips around the mouthpiece, and they're going to take a long, slow breath in and then exhale actively, but not forcefully through the device. The added flow on inhalation makes it easier for the patient to take a deep breath in and will prolong their exhalation. This extends the amount of oscillations they get, helping keep those airways open while also clearing the airways of any excess secretions. It's going to be up to you and the practitioners in your department to review the protocol you have for how often to have your patients do this treatment. Some departments opt for shorter treatment times several times throughout the day, while others seem to like longer treatments and maybe only twice a day. You are trying to maximize their secretion clearance, decrease atelectasis, reduce hyperinflation, and this is an excellent way to do it with the devices working in tandem. When the treatment is over, you can unhook the tubing and go ahead and set the two combined devices at the bedside. Please remember to have a look at the full product insert, and thanks for joining me today.